Why does it matter that some parents choose not to get their kids vaccinated? Why should those of us who do get our kids vaccinated care about that?
Well, public health officials, Jim, would tell you it's all about herd immunity in terms of a shield. Let's use that metaphor, right? A shield from disease. And so when it comes to protecting the masses, we're really looking at a percentage. And it varies by disease, but let's take measles, a highly contagious disease. First of all, I'm not a doctor, but this is from the CDC and bona fide health experts say it's going to take about 95% of the population being fully vaccinated against that disease to protect the herd, right? To protect the rest of us. So public health officials, in order to protect the rest of us, want to get those numbers about that.
Okay,
level.
so Karen, I think everybody knows that Massachusetts as a whole has a very high vaccination rate. That's something to be celebrated, not so much in parts of Western Massachusetts. Tell us a little bit about your reporting.
Right. Well, Western Mass probably also as a whole is not doing that poorly, but there are some particularly rural areas and rural schools, like in Franklin County and Greenfield, in Berkshire County, where the rates are well below herd immunity. So not just 94%, but 51%. Greenfield High School, which is a major high school, has a for the entire vaccine series a rate of 51%. Some schools are 68%, 74%. So, from this doesn't mean that much to the random person, but to public health officials, it's pretty worrisome.
Why are the numbers so low?
Well, it could be a matter of records. Like it could be that that's not actually how few kids are vaccinated. It could be that they're missing one. So maybe they're just missing chickenpox, or maybe they're just missing tetanus or something like that. There could be different explanations.
Okay, Karen, because I am obsessed with this, I went bananas when I read this quote from a public health nurse in your story who said, "Hey, if they don't want to get a vaccine, it's their choice, and they maybe become sick, but the rest of the population is going to be protected if they have vaccines." This is a public school nurse. Doesn't she know that there are people that are immunocompromised?
That was surprising to me.
This is a public nurse, so I think this is. Did you ask her about what happens to the kid who's in cancer treatment, who is in school?
She is again, like, I don't know if this is correct or not, but she is among the people that feels like those numbers are not as low as they appear. So it's not really 50%, but it's probably still like 80%, even if you account for all the different paperwork. So yeah, I did ask her, and that's kind of her view on it. But then I talked to the epidemiologist for Franklin County, who is like, even if you take all of these possible extenuating circumstances into account, you still got really low rates. And the problem is, if there is an outbreak, that's when we're going to really see it. So right now, there hasn't been an outbreak.
So, Gilda, what's happening on the islands?
Well, that was something that Chris Burrell was taking a look at, but he did let me know something that gave me like a kind of a seed for a question for my story, which was he was talking to a pediatrician, one of the very few pediatricians on Martha's Vineyard, who was saying that immigration fears are playing into reasons why people with immigrants in their family or who are immigrants might not be getting out to get their vaccines or just getting to the doctor as often as they might be under more typical circumstances. And New Bedford, which is what I looked at in my story, has kind of a similar immigrant population. And so I was interested to see if that phenomenon was happening in New Bedford.
And is it?
It is. Cheryl Bartlett, CEO of the New Bedford Community Health Center, was telling me that basically it's a lot of times kids who aren't able to come in for their vaccine appointments because either parents have been detained or there are fears about parents being detained, and then there's no one to bring in.
We have some sound from her and you. Cheryl Bartlett of New Bedford Community Health talking about the potential impacts of HHS policy that limits undocumented immigrant access to community health centers. Here it is.
And now we're being told that if this rule goes into place, we will have to verify if someone is a citizen. And then there are different qualifications of who would be refused care. And I have to say, I've been a nurse for over 50 years, and the idea of turning people away is just sort of against my whole career.
I love that she said that. I love that she said that.
So, Jennifer, I think our colleague Adam Riley did a lot of interviews with people who are claiming that they need religious exemptions because they've talked to God and God told them this is the way to go. Again, and the reason I get so upset about this story is because there are many children who cannot get vaccinated. So these people that have spoken to God, I'm not sure what God thinks about their putting those children at risk of death, because if you can't get vaccinated, you're immunocompromised. Measles is a very serious disease. Whooping cough. If you see the pictures of infants with whooping cough, I can't even look at it. It's so upsetting. That doesn't seem to enter into their holy concerns.
So this was a fascinating story, and I will say a fascinating and somewhat novel approach for a newsroom to take, and just seeking out parents who have gotten the religious exemption from a faith perspective, a faith story. And so GBH's Adam Riley tackled that and found many parents who have a religious exemption in place, meaning their kids are not vaccinated and they've signed a waiver or document saying, due to religion, I don't want to vaccinate my kids. And what he found surprised us in that it was a wide variety. Yes, you had the, I think you would maybe say more, maybe spiritual, folks who said that I hear from God, I'm being led by the Holy Spirit or by God not to vaccinate my kids. But you also had more pragmatic or dogmatic parents in terms of Catholicism. We also spoke to a Muslim parent who objected to the use of pork in some vaccine ingredients.
Or the fetal cells back from the 1960s.
And we tried to be really clear in our reporting that there's no fetal tissue currently in today's vaccines. But yes, this was a wide variety of reasons, and I will say it was good to hear those voices because I think that informs policy and informs understanding.
So I said right before the break, Jennifer, that you would list all the religions that say that those adherents cannot be vaccinated. How many are there?
So that's a short list in terms of a very, very short list in terms of religious texts, at least that I found in our series, that downright and outright ban vaccines. Thou shalt not take a vaccine. However, Jim, I will push back a little bit and say the freedom of religion, the First Amendment, does cover the interpretation of faith, the interpretation of those texts. And that's what we found people really clinging to in terms of this exemption.
Well,
Hold on. There are no texts because there were no vaccines when the texts were written. So what are they interpreting?
For the originalists.
So that is an originalist interpretation. But no, what I mean by that is, for example, we found that Catholics some practicing Catholics who are aware that there are some vaccines that began with the tissue or the cell lines, right, of aborted fetuses, so from abortion. So that, by principle, they are against.
But the Vatican has said you can be vaccinated.
Listen, this story was, I got to edit this, and this was a complex story to edit, as you can imagine. But that's why this topic was so fascinating, is because it pits together these core values most of us hold dear, right? The freedom of religion, the body autonomy, the government mandates, personal liberties. All of it is
You're
right
so
there.
much nicer than I am. I think this is selfishness.
I mean, keep in
I think
mind-
this is absolute
Karen, go ahead.
selfishness.
Well, I just wanted to add that some people might not actually have religious objections, but they say they
They
do.
make them up.
And you don't have to prove anything. All you have to
No,
do
this
is
is what
assert.
I was talking to the Springfield, Massachusetts spokesperson who said, you just sign a statement and we do not ask anything more. So I think given that Massachusetts does not have a philosophical exemption, that's the only exemption people feel like they can get. So I just think
That's a
that's
great
important to
point.
remember.
Well, let me,
other
if I may, California repealed its religious exemption in 2015. As far as I know, it stands 10 years later. Connecticut repealed it in 2021. Maine repealed it in 2021. New York repealed it in 2019. Who of you can tell us what I know there are bills before the legislature to repeal the religious exemption here, too. Jennifer, you're nodding, looking at me. What's the status? Andy Vargas is the state rep, I think, who proposed eliminating the religious exemption. What's going on with that?
There are multiple bills
there
in
are.
front of the State House. Yes, multiple bills, I would say, on both sides of this issue in terms of doing away with the religious mandate, the religious vaccine exemption, rather, and keeping it. And so this is a hotly contested issue at the State House right now. And Karen's exactly right. This, we found that some parents are using the religious exemption, and at the same time, they have other reasons for seeking exemption. So they have political reasons, or they have cultural reasons, or some even medical reasons. But the medical
Well, there is
exemption,
a medical exemption.
There
of
is a
course.
medical exemption,
Which
but
there
it's
should
tougher
be.
to get.
Which there absolutely should be.
Where you actually have to prove something.
It's got a higher
You
bar.
can't just make an assertion, right? Like you can make around the religious exemption situation.
Okay, so where do we think we're going here?
Well, I think, religion is just one piece of such a broad, constellation of issues around vaccinations in Massachusetts. And interestingly, there's people who some people think, oh, you should be getting them, and they can get it, but maybe they don't want to get it for religion. And then there's people who maybe want to get it who can't, or it's hard. And that's kind of the idea of community health centers. Again, I was talking to Cheryl Bartlett, New Bedford, and it's supposed to be for anyone, but there is some interesting potential policy changes coming down from the Department of Health and Human Services.
Do you know what we failed? When we had Mar Healy with us last month.
Which, by the way, is that public health is not going to serve people who are here that came over the border illegally, or their parents came over the border illegally. So they would have to pay for it, which can be very expensive.
That is where we might be heading. It all kind of depends on how it plays out in the courts. But yeah, vaccines, if you don't have insurance or you can't get to it, our community health center are very, very expensive.
Well, I started to say on that note, when we had Healy, Governor Healy in here, we know that she was requiring that insurance companies pay for vaccines. We asked her if you didn't have insurance, if the state would make sure it was covered. She said yes. We didn't ask her about people who are undocumented here, which is piece of what
Well, there are different rules for undocumented, for immigrants, and for unhoused
in terms of
people.
the state.
In terms of the requirements, they have a different bar, and you don't have to meet the same requirements.
What do you mean? I mean, a kid who is here undocumented doesn't need to.
They basically tell the schools, do not be as hard on unhoused people. And this is what they told me. And
But that's
certain
an
immigrants.
informal policy. That's not some statewide policy, is
I
it,
think
or is
I
it?
think it actually is. I mean, I think it's also worth noting that the schools do almost nothing when people are not vaccinated. So even though this is a requirement, this is one of the things that I looked at in my story, the schools still let you go to school. So the aspect of it being a requirement is a little...
Can I add one more thing to this whole legislative thing? Is whether you, as Jennifer said a minute ago, there is legislation to get rid of this. There's legislation to protect the religious exemption. We on this show, this is me and Marjorie, we're not speaking for the three reporters here, believe that at least we have an obligation to know where things are. In wonderful reporting by another of our colleagues, Katie Lannon, neither the Speaker, Mariano, the Senate president will give any indication to the public about where they stand on this issue.
Or the governor. The governor was indirect as well.
Let me quote from Katie's piece. Governor Moore Healy was similarly indirect when asked if Massachusetts should follow Maine, New York, and Connecticut on religious exemptions. You're not entitled to a position. You're entitled, I think, at least to some disclosure about where they stand, but we're not getting it.
Yeah, and I will say, Katie Lannon, in her reporting, she was the reporter in the room who posed that question directly to Healy. And she also notes in her reporting that, yes, to move these bills forward, they really do need Senate and House leadership, right? And so indicated and revealed that it doesn't appear at this point to be a raging priority.
And by the way, there are the tiny number of kids who are hurt by these vaccines, and there's a vaccination court where you can go to take your claims if you have a child who does suffer from seizures or something else. Very, very rare, but it does happen. But there's a remedy. But the thing I always get back to is I can't believe I was just so
That's
stunned.
why you need herd immunity, right?
Yeah,
Those
but
kids.
but the idea that if you do have an immunocompromised child and these rates continue to go, you really can't send your child to school. So I don't understand why there isn't any concern for the kid who had leukemia, the kid who had some other kind
I think what the nurse that I spoke to would say is if there is an outbreak, those kids should stay home. The problem is at what point,
But
do you
the
know when?
child that's immunocompromised may be infected.
Yeah, absolutely.
And
I'm
so-
just telling you that's
I
sort
mean,
of their
it's
argument. yeah.
kind of really irresponsible of the schools, it seems to me. But I'm a fanatic about this.
Do you have any do you have any sense? But I think the answer is probably no, Jennifer, because of what we just said from Katie Lannon's reporting. Do we have any sense of the prospects of this Vargas or other bills that would cause us to join Connecticut, New York, California, Maine, all those states, or
Well,
no?
I think it starts with awareness, right? And it starts with, in some cases, reporting like this. And one of the reasons we wanted to do this series is that there isn't a lot out there from a statewide or even hyper-local level, which is what really this series gets to. So I think, Jim, to answer your question, I think once people are more aware of the rates in their communities, that there might be more interest.
By the way, 70% of the people in Massachusetts support eliminating the religious exemption, but as we learned, 71% support auditing the legislature too, and that ain't happening anytime soon. Jennifer,
Yeah.
you had one final thought?
I may just say, yes, going back to your original question, Marjorie, why we decided to do this. You know, one of the criticisms of journalism more broadly is that we are very reactionary and we don't respond or cover something until disaster strikes. And so I really want to applaud my colleagues here at CAI and NEPM, in addition to GBH, for taking this seriously and looking at the data, because this is a story about vulnerability and risk. And to me, that is a huge story. So,
Yeah, and I was shocked by the lower rate, the rates that
As
were
was
so low.
I.
I couldn't believe that they were so low and that the schools seemed to be unconcerned about it. Anyway, thank
Thanks
you
you
very
all.
much,
Thanks
you
for your
guys.
work. Thank you.
Congratulations
Thanks for coming.
on a great job. We've been speaking with GBH Features and Statewide Editor Jennifer Moore, NEPM reporter Karen Brown, CAI reporter and All Things Considered host Gilda Geist. Thank you again for coming in. For more info on GBH's Unraveling Immunity series, head to gbhnews.org and look for Unraveling Immunity.